Hey everyone, I'm Anvi and I work for Southwest Behavioral and Health Services. I'm joined by Dr. Lori Cessna, the Program Director of the Southwest Behavioral Methadone Clinic on 7th Ave. And today we're going to talk a little bit about medication-assisted therapy. Thanks for joining us, Dr. Cessna.
Thank you. Thanks for having me.
So we're just going to get started. The first question I wanted to ask you is pretty general, and it's just what even is medication-assisted treatment and why is it so effective?
So medication-assisted treatment, or what we call MAT services, includes methadone, buprenorphine, and also naltrexone. It's used to treat opioid dependence and addiction. For short-acting opiates like heroin, morphine, codeine, as well as those semi-synthetic opioids like oxycodone and hydrocodone. It's taken safely, and people have used medication-assisted treatment for many years. People sometimes choose to use it for months, but it is effective for use for years and even over a lifetime. Medication-assisted treatment programs are effective because it's a safe and controlled way to administer medication to overcome the use of opioid abuse. These medications relieve withdrawal symptoms and also psychological cravings. And research has shown that when used properly, these medications are very effective and they don't have any adverse side effects long term in a person's ability to live a healthy and productive life.
So in the beginning, you brought up a couple of different treatments for MAT services. Could you talk a little bit more about them and how they differ in treatment?
Sure. So when we talk about MAT, or medication-assisted treatment, typically what people mean is either methadone, buprenorphine, or naltrexone. Methadone specifically is dispensed usually daily. People come to a clinic to get their daily dose, and the dose is very dependent on the person's needs, which includes their level of dependence on it, and also just their preference in coming to the clinic and what we call privileges. Buprenorphine is taken orally. It's usually a strip or a pill, and it is taken daily, but that comes with a prescription. And naltrexone is a monthly injection that people can obtain from a licensed physician. So we use that. All of those different medications we use in conjunction with counseling and other behavioral therapies to provide a whole patient approach to opioid dependency. So methadone and buprenorphine reduce opioid cravings and withdrawal, and they blunt or block the effect of the opioids. And as I mentioned, they're taken once a day. Naltrexone works a little bit differently on the body. It blocks the opioid receptors, and it also is reported to reduce opioid cravings. And there's no potential for abuse or diversion with naltrexone. And again, as I mentioned, all of the medications used in MAT programs are prescribed, and they're highly monitored by a physician and are used as part of a multifaceted treatment to address all areas of the person's life.
So is there a preferred treatment between one over the other, or is it just dependent on what the individual needs at the time?
There really isn't a preferred. It really is, the doctor will sit down prior to prescribing any medications and determine which course of medication is best for the person. We have some patients who prefer methadone because they come to the clinic daily. It gives them an opportunity to have some structure in their life. And they meet regularly with their counselor or the nurses to really talk about their progress in our program. People who typically prefer buprenorphine are those who hold full-time jobs and they are not interested in coming to the clinic every day, but are engaged in other forms of therapies, maybe outside of the clinic, such as NA or other peer support programs.
Mm-hmm. So I think you mentioned this a little bit earlier, but to confirm, are buprenorphine and methadone opioids as well?
Yes, they are, but they act a little bit differently on the body. So that's where people get confused with, well, aren't you just trading one drug for another? And the beauty about methadone and buprenorphine is they're longer acting. And again, they help with the addiction component. So people who, let's say they're out looking for, they have an addiction, and let's say they're using heroin, for example. Heroin's very short acting. So they'd have to use a lot more heroin frequently to assist with that addiction that they've got. But the beauty about methadone is that it is longer acting, and it helps a person not have to chase that addiction, and they can go about in addressing their other needs in their life, such as getting a job and participating in counseling, maybe even repairing their relationships with family that have been disrupted due to their addiction. So it is a very controversial issue, but the use of MAT services is very helpful for people to go back to living a productive life.
Yeah, so you just mentioned it. I mean, in the position I'm in, I'm always hearing about how MAT is just replacing one addiction with another because you're just treating an addiction with another medication. But
Mhm.
what would you say to address stigmas associated with MAT?
Can you repeat that question? I'm sorry, breaking up a bit.
No, that's okay. Just essentially, what would you say to address stigmas associated with MAT, like the one you mentioned, that
Mhm.
these drugs are just replacing another drug addiction?
Well, I would say there's research that shows that people who are participating, actively participating in a MAC program for a minimum of 1 to 2 years show the greatest success in reaching their lifetime goals, because they're focused on addressing some of these behaviors that led to their addictive history. So, and MAT services are recommended by all of the national medical and drug abuse organizations, and they're evidence-based. So we know that it works. There's a lot of research out there that shows that people that are participating in these services uh, prevent relapse, death, and also increase their daily functioning in their goals.
When patients are coming into your clinic, are you often seeing that they or their families have this stigma about MAT?
Yeah, that's a great question. I would say that both of those are true. Um, Usually by the time someone gets to us who are interested in receiving MAT services, they've had some pretty significant life consequences because of their use. So either legal consequences or disruptions in their family because of that. And they come in with a stigma that, well, I don't know if I can be successful with this. And again, like you mentioned, trading one drug for another, but it's, not only educating them about the benefits, but also them experiencing it. The longer they're with us, um, the more they can see that this type of program works for them. And in conjunction, as I mentioned, with counseling, it really helps them identify what led to their use, and how they can introduce coping skills and other sorts of um, strategies to help address the behavioral component of addiction.
So, how easily can patients access MAT services in Arizona? Because I know in 2017, Arizona declared a state of emergency on opioid addiction. So,
Mhm.
has this changed before and after 2017? And what does it look like now?
It has changed, and it's still a work in progress, but as of right now, there are 65 different programs and locations throughout Arizona that can assist those who are interested in MAT services. I would say the greatest barrier is in rural areas where sometimes people have to travel upwards of 2 hours to get to a facility that offers MAT services. But currently, there are, if you're in the valley, there are quite a few programs that can get you into services same day. So that is a big shift from 2017. So again, I think it's still a work in progress, but there is definitely more access now than there was in 2017.
So in the more rural areas of Arizona, is there work being done to set up clinics?
There are hubs that offer MAT services, and those programs work with providing transportation to those who need to travel
Oh, great.
to obtain. So there is an increase in access, but again, if you're living in a rural part of Arizona, you could travel up to 2 hours to get to a facility, and when you're dosing every day, that can be a real challenge for people. So in those cases, buprenorphine, where you're getting a prescription and you can take it, manage your own medication, is a preferred method, but that's not always the case for some people.
Right. Well, thank you so much, Dr. Cessna. This was really great, and I think this was a lot of valuable information you provided. Thanks again for joining us today.
You're welcome. Thank you.